I am Professor Andrea Cicconetti and I work in Sapienza University of Rome since 1985. And I knew the first bicon implant in 1992. I insert without experience this type of implant in an old woman a lot of years ago. After that, I work in the unit of maxillofacial surgery and I am interested about bone grafts and free flaps and screw implant. I utilize a lot of screw implant. But after 10-12 years, I was very discouraged because I note that this type of patient has a lot of problems with bone grafts, with the membrane, with biomaterials, and with the screw implant because they are illogical. I think, in my opinion, are illogical, and I think to not really clinically driven. So I was very happy when in the 2006 I reintroduced in my private practice and here in the university and the oral surgery units the bicon implant, and so I had the possibility to resolve cases that are really complex, because we receive a lot of cases. So this young woman with the rehabilitation with the screw implant, with the total destruction of the maxillary, of the tissue of the maxilla, with phlogosis and so on, and we have the only possibility to remove all this type of screw implant, and the results was a maxillary totally destroyed with a morphology, not a regular morphology. So we studied all with the TC dental scan, and we see that really there are little places where we can introduce implants. But with the bicon implant, this type of patients is possible to do because we can utilize standard technique for this type of rehabilitation. So in the premaxilla, we insert an implant as a transnasal implant. In the sinus, we insert a transcrestal, make a transcrestal sinus surgery, and we utilize at the end the tuberosity in both sides. So it's possible to have a base for the a correct rehabilitation without the problem before that we have seen before, and with the connection, telescopic connection, a bar of Trinia. And this is the results of the patient. She is very happy after 8 years without phlogosis, without problems, and this is very beautiful possibility for this type of complex case. Another case is another woman. She had other implants, she lost other implants, and so we make the same. We make here in the premaxilla a split crest and a transcrestal sinus surgery, and we utilize the tuberosity. And this is the radiography, but we can see here, in this point, we have endodontic material in the sinus, and so we lost one implant, but it's possible to rehabilitate in the same mode with the Trinia bar, and the patient has a beautiful smile and is stable since 4 years, but we introduce after 6 months another implant, so to insert a locator in this point. This is very important. I think that Trinia material is very versatility, and in these complex cases is very important. When we have patients so as this, so we don't have nothing in the maxilla, we can utilize, this is the inspiration of School of Vienna with the Professor Ebers, we can utilize the nasopalatine duct, and so we can prepare a prosthesis with only one implant in the maxilla, and in the mandible the same. Same patients with other reconstruction, bone grafts, and she wanted to have a transposition of the nerve, but we utilize 4 ultra short implants and with a bar of Trinia, and he is stable after 12 years. So we can say that really we can have standard cases when we receive complex cases. So this is our standard situation with reconstruction with 4 implants in the maxilla and overdental in this mode, and we see that it's stable after years. And so these are the principles that we think are really important for a modern implantology. This is that Bicon is really a biomimetic implant because she has cement line, she has osteons and so on. And the biomimetic is for the prosthesis too, because we need in these complex cases an anisotropy, a material that is anisotropy, and so they have the same elasticity of the bone. And this is another point that we have to study in this moment, because we can utilize the short implant, and so we utilize only the alveolar part of the bone or the basal bone, and we don't interfere with other sutures of the face that you have to move. This is very important for the health of the patients, for the systemic health of the patients. So with Bicon implant it's possible to have simplification of the procedures based on a basic principle, so we have say in this moment. Thank you.